this is Lisa Canada. My presentation is on the effects of nurse-physician communication on patient outcomes. The research question that I chose to address is, how does the communication between nurse and physician affect patient care in the hospital setting? This is a significant problem because communication between nurse and physician plays a significant role in the patient's overall satisfaction with the hospital experience. Failure of nurse and physician to communicate effectively can lead to adverse outcomes. It could leave the patient feeling as if he or she is unimportant or doesn't matter. It could also lead to medication errors, hospital-acquired infections, and in some extreme cases, it can even lead to death. One of the articles quoted that communication between nurses and physicians is the one factor that is most associated with excess hospital mortality. This topic was chosen because I have personal experience both as a professional and as a patient in regards to how poor communication can be detrimental to patient care. Also, although positive advances have been made to improve communication, there's still a lot that needs to be learned and improved upon. This topic is significant to nursing practice because it's important for nurses to recognize their ability to communicate effectively with physicians. It's important for nurses to always be prepared to provide clear, concise information to the physician regarding the patient. And it's very important for the nurse to develop positive and professional relationships with all members of the treatment team, including physicians. Trust and respect between healthcare providers is the best predictor of how effective communication will be. So it's very important. The literature search was conducted at Cressman Library at Cedar Crest College and at the library of Lehigh Valley Hospital and Health Network. The keywords that were used in the search were communication, communication between doctor and patient, patient care, patient outcomes, and patient satisfaction. There were 3 databases that were used for this search. The first one was Google Scholar. The initial search yielded 134,000 articles. The search was then narrowed to articles written after 2007, full-text articles, and nursing-related journals, and that yielded 117 articles. And from those, based on their relevance to the topic, 5 journal articles were retrieved from that database. The second database used was the EBSCO, and the initial search yielded 239 articles. The narrowed search yielded 16 articles, and 1 journal article was retrieved from EBSCO. And the final database used was SAGE. The initial search yielded 3,110 articles. The narrowed search yielded 24 articles, and the final retrieval was 2 journal articles. From those articles, the journal article that I chose to critique was entitled Intensive Care Units, Communication Between Nurses and Physicians, and Patients' Outcomes. The study problem was that it's currently unclear to what extent improved communication between nurse and physician influences adverse patient outcomes. And it's currently unknown how the nurse's perception of the quality of communication plays a part in how effective the communication actually is, and how their perceptions may differ from the physician's perception. There were 2 purposes to this study. The first one was to determine the relationship between the nurse's perception of elements of communication between nurse and physician and rates of selected outcomes, which were identified as pressure ulcers, ventilator-associated pneumonia, and bloodstream infections. The second purpose was to determine the relationship of characteristics of the practice environment to rates of those same 3 outcomes. The independent variables of the study were the staffing mix, which was the ratio of registered nurses to non-licensed nursing personnel, the hours of nursing care provided per patient per day, and the capacity utilization, which is the ratio of occupancy rate to the length of stay. The dependent variables were identified as communication between nurse and physician in terms of accuracy, openness, timeliness, and understanding, and the patient outcomes, which again were the prevalence of pressure ulcers, ventilator-associated pneumonia, and bloodstream infections. There were also a few demographic variables. In order to participate in the study, the nurse had to be working part-time or full-time, had to have completed their orientation period, and spend at least 50% of their time as a staff nurse. The study design was a cross-sectional survey. It was used to query nurses on their perceptions of workplace empowerment in the work environment and on the effectiveness of communication between nurse and physician. And the outcome data was collected over a 5-month period because surveys were not distributed all at once. The study sample consisted of 866 registered nurses, 25 ICUs from several major healthcare organizations in Southeast Michigan. The individual patients, the participating nurses, and the hospitals all remained anonymous throughout the study. And the study was approved by the Institutional Review Board of the University of Michigan and the Institutional Review Board of the other participating institutions. For the results, 462 out of 866 nurses, which equaled 53.3%, completed the survey. In measuring the relationship of nurses' perceptions of communication between nurse and physician and select outcomes, the total communication scale was not significantly related to any outcomes. However, it was indicated that as the timeliness of communication increased, the prevalence of pressure ulcers decreased. Also, the greater the variance in nurses' perceptions of communication with physicians, the greater the rates of ventilator-associated pneumonia. The hours of nursing care provided per patient per day were positively associated with bloodstream infections. And staffing mix and hours of nursing care provided per patient per day were not associated with any other outcome. In measuring the relationship of characteristics of the practice environment to rates of select patient outcomes, there was a significant association between workplace empowerment and ventilator-associated pneumonia. The characteristics of practice environment did not contribute to adverse outcomes in the expected manner, and nurses' perceptions of communication between nurse and physician as a whole were not related to adverse outcomes. There were a few study limitations. It was a small sample size of 25 ICUs, which increased the possibility of a type 2 error, which is a failure to find significant relationship. There were low response rates on 4 of the 25 ICUs, less than 50% response rate. However, the results didn't differ significantly from the other units, so they were still included in the study. And also, all of the ICUs were located within the same geographical region, so the findings could not be generalized beyond that area. The study concluded that it is possible that a significant relationship between nurse-physician communication and the prevalence of pressure ulcers may have been found if a larger, broader area had been used. It's possible that the other factors besides communication could be more closely related to adverse patient outcomes, but more research does need to be done in those areas. And specific nursing care processes that improve or worsen a patient's outcome have rarely been studied. Communication with physicians is just one aspect of many responsibilities that nurses have towards their patients. As the results show, more research does need to be done to figure out what aspects of nursing have the biggest effect on patient care and outcomes. Although communication remains crucial, the results imply that there's not as significant of a relationship between communication and patient outcomes as initially thought. And as more research is done to determine what these other factors are, it is imperative for nurses to continue utilizing their skills of critical thinking and professionalism.